Today I'm talking to Dr. Sian Stanley, who's the Clinical Director of the Primary Care Network for Stort, Valley and Villages, which is on the commuter belt from London.
What I think we don't understand is why we can't test for COVID-19 in the community. So basically we're seeing the patients and then saying, well, you might have COVID, we're not 100% sure, but you might have COVID, and then we're having to send them away to go and establish whether they can get a COVID test somewhere else. And there seems to be a disconnect between the app that's been produced and the actual clinical management, because it does matter that the GP knows that someone's COVID-19 positive or not. It does matter because we will be able to put it in the context of their overall health, and we can monitor the patients. But what's interesting in this particular disease is we've sort of been chopped out of the equation. So whilst patients do want to consult with us because they know us and they understand the systems that work around general practice, at first we were told to send them all to 111. And then we're being sent telling them all to go and get an app done. And actually, all the important insights and inputs that we've got are just not being seen not by the patients, but by the higher up the food chain, as it were.
Looking at your patients who have had COVID, how have you found their time to recovery?
It's very variable, but people who've had it hard, it can be a matter of weeks. A lot of people get the headache that seems to linger along afterwards for quite some time. The fatigue is enormous, and that can go on for anything up to 3 weeks, 4 weeks, we find. And then we've got to kind of help them. They're feeling terrible. They feel terrible. A
little bit about what you've done to help patients find your COVID hotspot. I was very intrigued by your video. Perhaps you'd tell us a little bit about your video.
I had a colleague video the patient journey into the hospital, where to park, where to get their tablets from afterwards, how to get through the system, and saying really important things like, please don't use our toilet, really simple things about trying to keep infection control in place throughout the whole encounter between the patient and the doctor.
One of the things you also mentioned was that you have created a video for the doctors visiting the COVID hotspot.
Oh, so the doctors and the clinicians that come to the hotspot, of course, rotating through, because we appreciate it's very difficult to do hot doctor work even daily. So the practices have a rota, and they will supply staff on a particular day, but they're often different. So what we have is we have a little video that shows the doctor the walk-through journey of the clean rooms, the dirty rooms, and how to get themselves doffed and donned in PPE.
But you have a third video that you have, and that's to educate your patients.
So we have these boxes with SATS monitors, and we have written instructions in there and a little chart that the patients can fill out. But superimposed with that is this little video that helps them to understand how to read the SATS monitor. So it's silly things like reading it the right way up and making sure that you write the SATS, not the pulse, and understanding what you're doing with the SATS monitor. The little video just helps patients understand what they're doing and why they're doing it. And so they... and we phone them every day. We have a little virtual ward, so we then phone the patient every day. They're told to expect our phone call. They have their chart in front of us. What is good is the idea the GP saying to you, oh no, we'll just keep an eye on you for another 48 hours or not. Or, holy moly, you need to be in hospital, and that's what we're doing.
Today I've been talking to Dr. Sian Stanley, who's the Clinical Director of Stort, Villages and Valley Primary Care Network. Thank you very much, Sian.
Pleasure.